Now we are going to describe the cranial cavity, starting by describing the skull cap. The internal surface of the vault of the skull, or skull cap, shows a sagittal groove in the median plane that corresponds to the sagittal suture. It lodges the superior sagittal sinus. On each side of the sagittal groove, there are a number of granular pits that lodge the arachnoid granulations and are more evident in old age. Through the arachnoid granulations, the cerebrospinal fluid passes from the subarachnoid space to the superior sagittal sinus. On the internal surface of the side of the skull cap, there are the grooves for the middle meningeal vessels. The floor of the cranial cavity is formed by the upper surface of the base of the skull. It is divided into three fossae: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Now we're going to describe the anterior cranial fossa. This is the anterior cranial fossa, which lodges the frontal lobe of the brain. Its floor is formed by three bones: the ethmoid bone, the orbital plate of the frontal bone, and the sphenoid bone. It presents the crista galli, which is a median projection from the ethmoid bone. On each side of the crista galli, there is the cribriform plate of ethmoid, which transmits the fibers of the olfactory nerve through its foramina. Immediately anterior to the crista galli, there is the foramen cecum, which generally ends blindly, but open into the nasal cavity and transmits an emissary vein from the nasal mucosa to the superior sagittal sinus. The orbital plate of the frontal bone forms the roof of the orbit and meets posteriorly with the lesser wing of the sphenoid, which forms the sharp free posterior edge of the anterior cranial fossa. Middle cranial fossa. This is the middle cranial fossa. It consists of a medium narrow part and two expanded lateral parts, one on each side. The median part is formed by the body of a sphenoid, whose superior surface shows the hypophyseal fossa that lodges the hypophysis cerebri, or pituitary gland. Anterior to the hypophyseal fossa, there is the groove for optic chiasma. This groove leads on each side to an optic canal, which transmits the optic nerve and ophthalmic artery. The area of the superior surface of the body of the sphenoid is bounded by the groove for optic chiasma in front and by the dorsum celli behind, and is called sella turcica. The dorsum celli projects on each side to form the posterior clinoid process, which gives attachment to the peripheral or attached margin of the tentorium cerebelli. The medial end of the lesser wing of the sphenoid projects as the anterior clinoid process, which gives attachment to the free edge of the tentorium cerebelli. Inside the body of the sphenoid, there is a sphenoidal air sinus, and on its side there is the groove for the internal carotid artery. This is the lateral aspect of the middle cranial fossa. Its floor is formed mainly by the greater wing of the sphenoid, in addition to contributions from the petrous and squamous parts of temporal bone. It lodges the temporal lobe of the brain. It is limited in front by the lesser wing of the sphenoid and behind by the upper border of the petrous temporal. The superior orbital fissure is a slit between the greater and lesser wings of the sphenoid. It transmits the ophthalmic veins and the third, fourth, and sixth nerves, and the ophthalmic division of the fifth nerve. Immediately behind the medial end of the fissure, there is the foramen rotundum. Rotundum means rounded, which transmits the maxillary nerve to the pterygopalatine fossa. Behind the foramen rotundum, there is the foramen ovale, which transmits mainly the mandibular nerve, in addition to the lesser petrosal and emissary vein. Posterior and lateral to the foramen ovale lies the foramen spinosum, which transmits the middle meningeal artery and nervus spinosus. The groove for this artery extends forwards and laterally from the foramen towards the lateral end of the lesser wing of the sphenoid. The anterior division of the artery grooves the internal surface of the pterion and then arches backwards across the parietal bone. At the pterion, the groove may be converted into a canal. The foramen lacerum is located between the petrous temporal and the sphenoid bone. The carotid canal, which transmits the internal carotid artery, passes through the petrous temporal and ends at the foramen lacerum. The internal carotid passes over the floor of the foramen lacerum, which is filled with cartilage. The anterior surface of the petrous temporal presents three main features. Most medially, there is a depression for the trigeminal ganglia. It is enclosed within a dural sheath called cavum trigeminal. Most laterally, the bone forms the roof of the middle ear and the mastoid antrum and is called tegmen tympani. In between these two areas, there is the arcuate eminence, which is produced by the anterior semicircular canal. This eminence is related anteriorly to two narrow grooves, one for the greater petrosal nerve and the other for the lesser petrosal nerve. The later groove continues to the foramen ovale. Posterior cranial fossa. It lodges the cerebellum and lower two-thirds of the brain stem, which comprises the pons and the medulla oblongata. The fossa is covered by the tentorium cerebelli, which is a fold of dura mater that separates the cerebellum from the occipital lobe of the cerebrum. This fold is attached anteriorly to the superior border of the petrous bone and posteriorly to the lips of the transverse groove, which lodges the transverse sinus. The groove for the transverse sinus turns downwards, just behind the base of the petrous temporal sigmoid groove. That lodges the sigmoid sinus, which ends at the jugular foramen to become the internal jugular vein. It is to be noted that the sigmoid sinus is a direct posterior relation to the mastoid antrum, which is a cavity communicating with the middle ear. Also, that the mastoid emissary foramen is closely related to the sigmoid groove. The posterior surface of the petrous temporal presents the internal auditory or acoustic meatus, which transmits the facial and the vestibulocochlear nerves and the labyrinthine artery. This is the foramen magnum, which is the biggest foramen and contains the lower end of the medulla oblongata and the tonsils of the cerebellum. The surrounding meninges transmit the two vertebral arteries and the spinal roots of the accessory nerves, and the anterior and the posterior spinal arteries that arise from the fourth part of the vertebral artery and descend into the vertebral canal. The hypoglossal canal is found just below the jugular tubercle, which is an elevation present between the foramen magnum and jugular foramen. The hypoglossal canal transmits the hypoglossal nerve. The jugular foramen lies below the internal auditory meatus and transmits the internal jugular vein into its lateral part, the inferior petrosal sinus into its medial part, and the 9th, 10th, and 11th nerves in between the two venous channels. The superior petrosal sulcus lies on the upper border of the petrous temporal, while the inferior petrosal sulcus separates the petrous temporal from the basilar part of the occipital bone. This sloping surface of the basilar part of occipital bone is called clivus and is related to the pons and the medulla oblongata. It reaches up to the body of sphenoid to fuse with it at the dorsum celli. Behind the foramen magnum, there is the internal occipital crest, which ascends upwards on the posterior wall of the fossa to reach the internal occipital protuberance, at which the right and left transverse sinuses and the superior sagittal sinus meet to form the confluence of sinuses.